So welcome back to SPED 738. In this module we're going to take a look at emotional or behavioral disorders, and this is an area that most of you in the course mentioned that you're interested in learning more about. So I think these are students that we are seeing more and more in schools with this kind of identification through testing, and can really prove to be one of the most challenging groups of students that we work with, just because the behaviors can really impact the classroom as a whole. And so we're going to take a look at really defining what emotional behavior disorders are, how those students are identified with that disability. And then, of course, as in every module, and our goal in this class is for you to have a really good understanding of the characteristics of students with different types of high incidence disabilities. So we're going to take a look closely at those characteristics of students with EBD and look at some of the causes, and then look briefly at addressing some behaviors in the classroom. What you'll find at the conclusion of this module is you'll have an activity to do where you can really do some self-guided learning on a topic related to EBD that most interests you. Since everyone really identified this as an area of interest for them, what I've done is found some learning modules related to a variety of things, from working with students in early childhood to working with students in a juvenile detention setting, to positive behavior management in the classroom, to setting up behavior management plans. And so you can kind of choose a topic that is most interesting to you to learn more about at the conclusion of the module. But first we want to look at really defining what emotional behavior disorders are. And the text talks about this, that IDA uses the term emotional disturbance as the condition that has kind of these characteristics. One is, we know that the students typically have difficulty in learning, that we can't really explain what's causing that difficulty in learning. Can't determine if it's an intellectual, sensory, or health factor that's impacting it, but something there is impacting their learning. These students really have a difficult time maintaining relationships, whether that's relationships with their peers, relationships within their family, relationships with teachers. And we will see later how language plays a role in that, and how it can really impact these students' ability to communicate and develop those relationships. We also see that these students also have inappropriate behaviors or feelings at times that are really, under normal circumstances, they should have very appropriate behaviors and feelings. That things, they can get agitated easily and quickly, and that escalates easily for them. Also, sometimes we see these pervasive mood issues where students with emotional behavior disorders seem to have a feeling of sadness all the time, of depression, something that we see frequently. And we're going to look into some of the factors that can contribute to those mood issues in particular. And then a lot of physical symptoms, fears about going to school, physical symptoms like my stomach hurts, my head hurts. You'll hear these students complain a lot about physical symptoms. It's almost the body's response to the emotional stress that they're under, or through the behaviors that they're exhibiting. Their physical response is making them feel not well. So you'll hear them complain about some of those physical symptoms from time to time. On the characteristics in terms of emotional characteristics, when we look at students identified with emotional disability, that typically is coming from a classification within the DSM-5. We talked about the DSM-5, if you remember, when we were looking at autism. But this is a manual that the American Psychiatric Association has developed, last updated in 2013, that describes these disorders. And this is what physicians, clinical psychologists typically use when they are identifying a student with one of these disabilities. So we have things like an anxiety disorder, and all kinds of things can fall under that anxiety disorder, whether it's a specific phobia, which is kind of an unrealistic, overwhelming sense of fear about something. You may work with a student that has that. Josie has several specific phobias that she deals with that really impacts what we can do as a family. One of them is dogs, and we have a pet. We have a dog who's an old guy. He's really easygoing. Josie's been around him her whole life. She's never had a situation where a dog has scared her. But for some reason over the last few years, she's developed this really uncontrollable phobia of dogs. And so we like to do things like ride bikes, but if we go out in our neighborhood and ride our bikes, chances are pretty high that we're going to run into somebody walking their dog. If she sees a dog, she immediately, it's that fight or flight mode. You can see it happen on her face. She sees it, she immediately gets off her bike and runs. Doesn't matter if she's going to run out in the street in front of a car or if she's going to run away from us where we can't catch her. So it really impacts what we do, as a family and things that we like to do together. We love to, our whole family does trail races together. And so we like to go support each other when we're doing that, but it's really hard because there's typically people there with dogs. And so if we go as a family, the majority of the time we spend kind of calming her fears, helping her get past that, but it's pretty tricky. Those phobias can really impact lifestyle. Separation anxiety you may see, especially with younger students, when you're working with students preschool, kindergarten, first grade, can have some of that separation anxiety, being afraid to do something without mom and dad or to leave them. And then just kind of social anxiety disorders, where students really feel anxious when they're in that social situation. They withdraw from it. When we look at mood disorders, this is just in general students having just an overwhelming sense of sadness, not feeling worthy of anything, crying often. They may have no interest or motivation in playing with their friends and doing schoolwork and doing things that they used to enjoy. May eat and sleep too much, may do that too little. Okay, kind of see two extremes there. And then just have really negative thoughts about themselves and about their life. So we are seeing an increase in students with mood disorders, and you've probably seen this on the news, some talk about the increase in the suicide rate among teens, and it's really kind of a disturbing phenomenon right now that the prevalence has increased significantly for our students, even from early childhood to adolescent. Pretty significant. Next one's bipolar disorder. This is really kind of a mood disorder, but identified as having extreme mood changes. Okay, so having extreme happiness to extreme sadness and depression. Oppositional defiant disorder. You will probably see some students with this diagnosis in your schools when they have an EBD diagnosis. This is one of the pretty typical disorders that students are identified with that fall underneath that EBD category. And this is one that can really prove some challenges for teachers, school personnel, and parents, because the key word in that is defiant. Most of the time students with this diagnosis are going to really have a lot of resistance to cooperating with adult requests, to taking any kind of direction from an adult or even from a peer. They're going to deliberately annoy others, to bother others, to misbehave. A loss of temper is a really common thing with oppositional defiant disorder. And there's just a lot of self-regulation issues with students with oppositional defiant disorder, self-regulating their response if they come into contact with a situation they don't like or someone says something to them they don't like. Usually their response is pretty extreme. So this can be a challenging disorder for schools to deal with. Conduct disorder is another one. Conduct disorder is really significant because students with conduct disorders are really imposing problems and interfering with other students. Okay, typically with this disorder, there's a lot of aggressive conduct, property destruction, theft, serious rule violations, things like running away, those kinds of things. So sometimes we see students with conduct disorders in more of a self-contained environment, sometimes even a residential program. And then schizophrenia is probably one that you have heard about before, but this involves hallucinations and some things like that. It's very much a emotional disorder that's classified typically by a physician through the DSM-5 with really specific things that they are looking for when they believe a student has that. When we think about behavioral characteristics, I think it's really important to think about it in the way the book lines it out. And I like how the authors do this in terms of externalizing behaviors and internalizing behaviors. And the reason that I think this is so important is because it's often easy for us to see students with those externalizing behaviors, those behaviors that are really disruptive to the classroom, that are disruptive to us trying to help them learn. But those internalizing behaviors are just as important, and sometimes we can overlook them, because they can be done quietly. They don't get our attention as much as those externalizing behaviors. But I will say, for teachers and for parents, both of these can be an extreme challenge. When we look at externalizing behaviors, just that persistence to be disruptive in the classroom, to not follow directions, to be bothering their peers, non-compliance when you're trying redirection, aggression. Okay, so these are things that typically when we look at least restrictive environment and what the best placement is for a student, one of the things we look at is, are they able to learn without any barriers in that situation? But we also look at safety of the classroom and safety for the teacher. And if we have aggressive behaviors occurring, we do have to look at the least restrictive environment not being necessarily that general ed classroom, because we do have to provide safety for our other students and for our teachers. So that's something we really kind of have to look at. And also look at how we manage that aggression. There's some talk in special ed about the use of restraint and when is restraint appropriate. In my experience, a restraint has been not appropriate most of the time. There are very few instances where I put my hands on a student to restrain them. Usually the reason I did that is it occurred because they were physically hurting another person, a staff member. With the particular student that I worked with the most that required restraint was a hair puller. And so she could get you down on the ground pretty quick pulling that hair, and that does not feel good. And she would not let go. And so those were times where we would have to physically remove her hands from another person. But I have had situations where I have done restraint, and then I've thought back again and thought, I could have handled that differently. It didn't require restraint. I'll give you an example of a student who was escalating, and we were at a vacation Bible school camp. And he really did not like to, he was on the autism spectrum, did not like to be separated from his peers. And he was starting to escalate his behavior. We knew he was escalating. We were getting to transition from a small group to a really large, kind of rowdy, loud end session to end the day. And we were really concerned about what he was going to do since his behaviors were starting to escalate a little bit. So we made the choice to remove him from the situation, which really, in hindsight, looking back, that was something that really set him off, was to think he was missing out on something. So when we thought we were helping, we were actually making it worse. And then he became very unsafe in the room that we were in, and so we had to do some restraint so that he wouldn't hurt himself by hitting his head into the wall. And so in that situation, looking back as a team that we were working together at that VBS, we had a speech language pathologist and a PT and myself. We sat down after that situation and thought, we contributed to that issue. We did not help him in that situation, partly because we didn't know him well enough to know what set him off, but we really wanted to make sure we learned from that and we didn't do it again with him. And the next time we felt like he was escalating, we allowed him to stay with the group. We just set him back towards the back of that group so he could do his walking back and forth and jumping and those things, and he wasn't being disruptive to everyone, but he was still able to participate, and that worked much better. So sometimes we have to think about those things and how we respond to things like aggression and disruption, and make sure that we're not contributing to it escalating even further, which is sometimes hard to do. When we look at internalizing behaviors, looking at that withdrawal, that feeling of depression, anxiety, fearfulness, like I said, these things can sometimes happen very quietly, and you don't realize they're occurring maybe as much as some of those externalizing behaviors that we see so easily. But it's really something to keep an eye out for our students with emotional behavior disorders. When we look at cognitive characteristics of these students, generally students with an EBD diagnosis are going to fall in that low average range for IQ. And we also see that their delays in reading, math, and written language continue to grow as they go through school. Now, some of the contribution to those delays is the fact that they do have less instruction time because of the behaviors that we're dealing with. And so it's just natural if you have a student that has some of those externalizing behaviors, where they're being disruptive, we're going to have pull-out time. We're not going to have that same quality of instructional time just because we're addressing those behaviors. The other interesting fact that I really found in the text, and I wanted to point you to, was this idea of a language disorder, and that 66% of students with EBD have an expressive and or receptive language disorder. If you think back to what we talked about in the autism module and talking about behavior as communication, you can see how if these students have a language disorder, so they're not communicating effectively, or they're not communicating the same as their peers, and then they have a tendency to overdo it on the behaviors, you can see how that is a cocktail for some real big issues, because they're not able to express themselves, and their body's ability to self-regulate their behaviors is not very good. So their response is much higher in terms of being disruptive and extreme. I thought there were I really was bothered by the facts about graduation and dropout. 38% of these students graduate with a diploma compared to 55% of all students with disabilities. So really significant decline in graduating with a diploma. The dropout rate is 52% compared to 31% of students without disabilities. And so as these students get into high school and their behaviors may become more aggressive, they're more difficult to manage, partly because of size too, as they become closer to being adults. The last thing we want to do is get them out of the school system. They need that support of the school system. Their parents need that support of the school system. So we really need to try as hard as we can at that high school level to avoid those dropout rates and ensure that they graduate with a diploma. That's how they're going to be most successful in life. And we're going to talk in a little bit about a concept that they pointed out in the text about using the IEP team as a team to connect with resources in the community and connect resources for the family. And that is a big piece of keeping these students in school until they graduate, is really having that team involved with mental health resources within the community, with state resources that provide care and assistance to the parents. All of those things play a really big role in ensuring that these students get to that diploma. When we look at prevalence, 14.5% of children today, their parents have talked to a healthcare provider or a school personnel about their behavior or emotional concerns. It's a pretty high number when you think about it. 2.9 million, almost 3 million of these kids have been prescribed medicine for these difficulties. Interesting thing, in high school, 75% of students identified with EBD are males. African Americans are at a rate of 25%, which is much higher. We talk about that disproportionality earlier in the semester. This is definitely a category where we see high disproportionality, especially in African Americans. And so when we look at factors that impact this, we'll take a look at some things that could be contributing to that disproportionality with African Americans.